Hello, everyone. My name is Yuz Yusof. I'm from Leeds. I'm reporting for Room Now, and we're reporting live from Milan, Italy. So it's nice to gather here to see our colleagues face to face and also to learn something new, which what we are here for. Today, I'm excited to attend several abstract sessions, and there's one abstract that I would like to point out because it can cause a little bit of controversy or maybe something that we need to discuss further in detail. So this abstract, the title, the number is OP0053. So this is a randomized control trial of Baricitinib, which is a JAK inhibitor in treating active lupus nephritis. As we all know, Baricitinib has been investigated in two phase 3 trials for non-renal lupus before, whereas the BRAVE-1 randomized control trial phase 3 were positive. However, the similar design for BRAVE-2, the outcome were negative. So therefore, the conclusion is a bit inconclusive whether the treatment will be effective for people with non-renal lupus. So this study looking at active lupus nephritis, the investigators described this as phase 3 randomized control trials, but this was only done in a single center in Egypt. In this study, so the two comparators, one is the Baricitinib plus monthly placebo infusion, whilst the second group is IV cyclophosphamide monthly infusion versus placebo tablets. The primary endpoint for this study is reduction of proteinuria of more than 50% from baseline. In this study, the follow-up was quite short, up to 24 weeks. The investigator report that there are more patients in the Baricitinib group achieve this proteinuria reduction compared to the cyclophosphamide at both 12 and also 24 weeks time point. In terms of the safety profile, so there was no significant difference compared to what already known in terms of side effect for Baricitinib, because the number is quite small. Interestingly, they did not report or observe any serious infection event, including herpes zoster, and there was no cardiovascular event, and also there's no venous thromboembolism events. The conclusion of the investigators were the Baricitinib appeared to be effective for remission induction in people with active lupus nephritis, which were defined as class 3 and 4, and also more than 0.5 milligram 24-hour protein and plus minus urinary CAS. However, in terms of interpretation of these results, it is a little bit, we have to interpret it with caution. First and foremost, in terms of the composite endpoints, the investigators only used reduction in proteinuria, whereas these days more composite index, including proteinuria, and also the renal function, like whether there's any decline in the eGFR or creatinine, and also requirement of steroids. So these are more ideal in more recent clinical trial in lupus nephritis. Other thing as well, although it's been described and registered as a phase 3, I don't think personally this is phase 3 as it is a single center. center. So these findings will need to be extrapolated to other multi-centers so that the findings can be generalized, and certainly longer term endpoint follow-up are needed. I think 24 weeks is quite short for management of patient with lupus nephritis. So in terms of a conclusion here, rather than we're quite convincing whether the treatment is effective in the patient, there are actually more questions, posed and more uncertainties in terms of the efficacy of baricitinib in treating a patient with lupus, and only time will tell. And if there's more further bigger studies are planned and will be eagerly anticipated. I hope you find it useful. So do follow me on my Twitter, Yuz Yusof, and follow us Room Now on Twitter, YouTube, website for more coverage of our Congress in Milan. Thank you.